All right, I'm live apparently. Not hearing anything. Hopefully this is working. So first of all, I'm really sorry I'm late by a lot. I had a PET scan. So as you know, because I had this history of breast cancer, I have to have a PET scan every 6 months. No, every 6 months. Um, and so I'm really not in the mood of talking about rheumatology. I think I was just thinking, as I was sitting in the area, it took a lot longer than I expected. Just some thoughts that I thought would be cool to share. And I think the reason I'm going to share those thoughts is that I'm a physician and a patient. Okay, so here I am doing a PET scan every 6 months, and you know, yes, I'm in remission, and that's been great, right? But the truth is that every time I go for those PET scan, I'm freaked out. I'm still freaked out. I probably, my heart rate is probably a little bit high. I'm probably breathing more superficially. And what's really interesting is that that's, there's like kind of like those two Isabel. There's the Isabel that's like, well, I'm really scared. And what if, this finds something? What if I have to go through chemo again? What if, this is scary and all this? And then the physician mind is very reassuring. And so that's really the one that I offer to my patients, right? Look, the truth is that the reason we should be grateful for those PET scans, so I tell this to myself, right? Like we can be grateful for the PET scan because if we find anything, we're finding it in such an earlier stage than ever. And really, all tests that we're doing are here to prevent, you know, further damage, further issues. Otherwise, you shouldn't be a test if it's just to do a test, right? And so, then the physician brain is like, well, not only, that like if we find something, we can take care of it. Then there is also and there are so many treatments, right? Because there is this mindset of like, oh my goodness, I would rather not know so that I can live blissfully. And then there is the physician mindset, which is like, no way, like you want to take care of this as soon as possible, whatever happens. So the truth is that I really, 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 really hope, and I'm visualizing that it's all perfect and it's boring for the radiologist, and that they are like their only comment is like, oh my goodness, those medication work so well, right? But it is true, I do have this mind, like I do have a little bit of discussion in my brain. And so yeah, it's not a rheumatology 101 because honestly, I first of all, it took more time than I've ever had a PET scan for. Second, I just don't think that I would give you a good rheumatology 101 today. So please bear with me. I'll do it next week. Um, and three, I thought, it is important to realize the reason why we're doing tests. And I'm sure all of you have gone through like, oh, I would rather not go to the doc, or oh, I don't wanna do this test. And you have to remember what is the reason behind all of those tests. And the reason behind tests is to see if it's working. And if it's not working, like, wouldn't you rather know earlier if it's not working and then have a new medication and so on? And then the second is, if it is working, like, is there any damage? Is there anything that we need to do differently? So, uh, hi, Rock Doc. Always pleasure. Doctor, any kind of test is stressful. I wonder whether, as a doctor, you get more stress because you know the possible outcomes in detail. And sending my very best wishes to you. Well, first of all, thank you so much, Rock Doc. Yeah, that's really interesting when you say, is it because I'm a physician that I get more? No, I think that the stress related to test is real. There's some studies on that. Uh, Actually, really, the physician mind is very reassuring. And so I don't think that that's the case. I think that it's my not knowing enough brain, or like, the sort of the stressed self. Uh, and, I mean, it was, from all my friends would tell you that I went through chemo and radiation therapy and surgery very nicely. But the truth is that there was PTSD still right afterwards, because then you're like, oh my goodness, I almost died. Like I could have died. And what if, what if, what if? What if is like, I think we should all remove that from our vocabulary. And if you do the what if, then just say, what if I stay in remission forever? What if I'm actually cured? What if, new treatments are coming so that, we can treat everything? And really, honestly, as a physician, I can tell you, I'm so optimistic, and I'm optimistic realistically because we have so many good medications. So yeah, to answer your question, I think really the main thing is, as a physician, I'm able to reassure myself. As a patient, it is stressful because it's like the what if. And sometimes you just have to let it go and be like, okay, my doc will know what to do no matter what, right? My doc probably will tell me it's all good, don't worry. all, all good, right? Um, but yeah, it was really an interesting time of just being a patient. It's always very humbling to be a patient, and I really think that we become way better like much better doctors, because we really walk in the shoes then, right? So yeah, I'm going to enjoy myself right now. I have a team meeting, but after that, I think I'm gonna take it off. I'm just gonna like relax a little bit. And that's the other thing that's really cool is I was telling this to one of my patients. I was like, when you have something that's a little stressful, a little bit annoying, like just like an injection, you need to start a new treatment, or you have a test to do, couple it with something really good for you. So, right. So instead of seeing the PET scan, I could see the really good restaurant that I've scheduled. I have not. I should have. But you could literally be like, okay, I'm gonna inject my first Humira, or I'm gonna get this new medication. Anything, right? Anything that's a little bit stressful, couple it with. But as soon as I'm done, I'm offering this to myself. So it could be a dress for a woman, anything that makes you happy. So that's like my way to coping with things that are a little bit stressful. Uh, and that has worked for a lot of my patients. They send me what they've done, and it's usually really cool. So anyway, that's me. Send positive thoughts my way. Hopefully, it's all good, and I don't have to worry too much about this. And medicine is so powerful, and just in rheumatology particularly, I think in oncology we're seeing so many good stuff. And so yeah, I hope you're not mad at me for not doing rheumatology today. Next week we'll be there and on time. All right, take care, everyone. Thank you. Bye bye.